Prostate cancer is a disease that affects men starting from around the age of 45. Since 2010, prostate cancer has been the second most common cancer among men worldwide. And, according to the American Cancer Society, over 215,000 men in the U.S. alone have been diagnosed each year, with about 30,000 men on average annually dying from this terrible disease. The good news is that prostate cancer is most often found in its early stages, and thanks to medical advances, a number of treatment choices are available. When detected and treated early, men with prostate cancer confined to the prostate gland have a much greater chance of survival. That is why more than 2 million men in the United States count themselves as prostate cancer survivors. It is important to be proactive about your treatment and understand your options for treating prostate cancer. One of these prostate cancer treatment options is cryotherapy, which can be performed with medical devices from Endocare. Cryotherapy is a minimally invasive procedure that destroys cancerous cells by delivering freezing temperatures of -40 degrees Celsius or colder to the prostate. An important distinction of cryotherapy is that it does not involve open surgery or radiation. For the next few minutes, you'll hear from actual patients who will discuss their prostate cancer. You'll also hear from physicians who will discuss treatment options and provide you with important information regarding prostate cancer, helping you make your decision for treatment. You'll also hear from family members who will relate their feelings and experiences, as well as from experts on the cryotherapy procedure. And finally, you'll hear from patients who choose cryotherapy and what their lifestyles are today. Please note that all information presented in this video is for informational purposes only. It is not specific medical advice for any individual. The information presented should not be construed as medical consultation or instruction. No one should take action solely on the basis of this presentation. Viewers are advised to consult a health professional about any issue regarding their health and well-being. While the information presented here is believed to be fair and balanced, viewers who fail to seek counsel from appropriate health professionals assume risk of any ill effects. These risks may include, but are not limited to, erectile dysfunction, incontinence, urinary retention, urethral sloughing, and urorectal fistula. In addition, any surgical procedure has associated risks that must be discussed with the surgeon.
All these good things that you can do, a human being can do for him or herself, and that's for the rest of the world, is valid only if they're alive.
I don't think prostate cancer is nearly as scary now as it was on day one when you first heard it.
So why not do what you should do? I mean, it's not a cold, it's something that is going to kill you. It's something that before it will kill you, it'll make your life miserable. So why you want to go through that?
You need to go see a urologist. This is not something, to fool around with.
And so I wasn't really, I didn't look at it as a death warrant, because I knew it's something that with the right procedure could take care of me.
To do something if necessary to sustain your life and your lifestyle and your relationship with your wife and your family.
He told me, you have prostate cancer, but it is incipient, so we can still treat it.
Actually, I didn't know what to think. I never had any kind of cancer before, but I'm a pragmatist, and it is what it is, and you deal with it. And I don't know if I could put it much better than that.
When I first learned that I had prostate cancer, my first thought was, I'm gonna die of this. If something isn't done, I'm gonna die.
I've been through cancer before. I accept these things pretty strongly. I don't let them bother me. What I do is I concentrate on the solution.
And I went with him, besides that, because I had to know. And I knew why he was going to urologist, And I was scared. I was really scared because Juan has always had wonderful health.
I was not had any symptoms. I was feeling fine, you know, until they told me I had cancer. Then I started feeling real bad about it, you know. It's like a drop in a bomb on you, you know. You don't know what to do. It was pretty hard.
We started going onto the internet, checking out, getting all the information we could about it. Our understanding is it was a very slow-growing cancer, and that I was fortunate it was discovered in an early stage.
And at that moment, he explained us what kind of surgery it was. And he told us something that I just didn't know. It was cryoablation.
We did feel lucky. I mean, we felt lucky that we found it early, and we felt optimistic that it wasn't going to be a death sentence.
Once I first diagnosed a patient with prostate cancer, the most important thing is to understand the stage, the grade, the tumor volume. Then we can choose the appropriate treatment, because choosing the wrong treatment for their disease process is going to doom them to failure. So it's very important first to understand their tumor volume.
In patients with localized prostate cancer, which is what we hope we find, we will sit down and talk to them about usually at least 3 or 4 different options of management. And these generally include watchful waiting with no treatment at all, but frequent follow-up visits with PSAs. We will also talk to them about radiation therapy and the different forms of radiation that exist and the different methods of administering radiation. We'll also talk about radical surgery, radical prostatectomy, and the different ways of doing that operation. And we also talk to them about primary cryotherapy as a form of treatment.
Well, patients do come and they ask, why do we need therapy, or how aggressive do we need to be with our therapy? And I explain to them that there's no way to differentiate which of these cancers are going to be more aggressive, which are going to go and metastasize or spread through the body, and I explain them their options.
If we look at the recuperation time for the other procedures, we're looking at a much longer time frame. With the new robotic radical prostatectomy, the patients are in the hospital maybe overnight. However, they will be wearing a catheter and have troubles with some urinary control initially. And in general, I will tell those patients, look, the robot is great. It doesn't make big incisions, but you still have all the major surgery inside that has to heal. And basically, it's 6 weeks to heal up.
I actually go through with them just a kind of a little brief history of my experience with cryo that extends back over 20 years, back to the early days of cryo, to make them understand how this treatment has advanced and progressed over the years.
When I discuss with them cryoablation of the prostate, they like this because there is minimal discomfort, it's outpatient procedure, there's no blood loss. In my hands, the incontinence is almost 0, and the only factor that we discuss is potency at that stage.
My major decision on the cryo was the less invasive. It was outpatient surgery. It didn't have ongoing chemotherapy or radiation.
Well, actually, I have a friend at home, an older gentleman, who had cryotherapy a number of years ago, and he's in perfect health. And so that had an influence. I also did do my own research online, you know, getting as much information as I could about what cryotherapy was, the procedures, how it's done. And I was even able to find some information or results about the success ratios, and they seemed to be quite positive. And you know, so I felt that it was, again, the right decision for me.
With the radical prostatectomy, a lot of patients say, I don't want to risk being incontinent. And so that's going to be taken off the table. Some patients will say, well, you know, my wife had breast radiation, or a cousin did, and boy, they had terrible problems with the radiation, and so I don't want radiation. And then we'll look at cryosurgery, and if they need total gland ablation, I'm going to tell them, look, the risk of incontinence are extremely low. You'll do well, but the problem is you're going to be impotent.
The relation between having your prostate gland and be able to continue having sexual activities, it becomes immaterial.
I would be more concerned about the incontinence than I would the sexual dysfunction.
I'd rather to have him, you know, together with me, alive, than a man, you know, that wants just sex and no love. No, that not even. I don't even think about it.
What is important is your life, your ability to keep breathing, to keep living a normal, useful life.
I did my research, and I truly think it's the best option you have.
Then he was saying, but he had something better. He said that he could freeze it.
The cryoablation really is a minimally invasive therapy. It has very little of any side effects. As I've mentioned, there's very little of any discomfort. There's a small catheter that's placed in the bladder for maybe 7 to 10 days. And it's a one-time treatment.
And he explained this procedure called cryoablation. We accept it. We say that's what we want.
The cryotherapy, which is a minor surgery, you go in the morning, you go out at night, you know, why not do it?
Among the various treatments, if the doctor doesn't offer cryo, I would definitely check with someone that does. There's probably been a lot of science between today and when I had my surgery, but it worked very well for me, and it was one of the up-to-date treatments that he described.
With cryosurgery, you're admitted as an outpatient into the hospital. You undergo an anesthetic, either general or spinal. The procedure usually lasts approximately an hour and a half to 2 hours. We introduce 6 to 8 probes into the prostate to introduce 2 gases, one for freezing and one for warming. And we're able to create what we define as lethal ice, which kills the prostate cancer and allows us to eradicate the disease, and within a short period of time, they're able to go home.
Typically, when the patient arrives to the recovery room, it takes about an hour, sometimes an hour and a half, until they're ready to go home. In our facility, once the patient is fully awake and stable, we will then move them to a secondary recovery area where they can sit up, and we will at that time bring their family and bring their wife in and give them something to drink, and then go over their post-operative instructions at home, management of their catheter, and their follow-up appointments, and then write them some prescriptions.
And he explained it, you know, by the letter, exactly what was going to happen, when it was going to happen. Even to the point that, you know, yes, I was going to probably experience some discomfort with the catheter that they would insert to allow me to continue to urinate while my body healed.
What I can tell you about the surgery is that it lasted just a few hours. Then I went back home, and I stayed at home for the full 2 weeks. And then with my wife's help, I took care of what I had to do.
So there were no real surprises. You know, I knew ahead of time what it was going to be like, and you know, what I could expect.
And he explained to me, you know, how this procedure goes, and I agreed to put myself into his hands. Thank God I made that decision, because it was a great outcome.
The recovery period for cryosurgery is surprisingly short. Within 3 to 5 days, the patients are up on their feet doing most of their normal activity. Generally, I tell patients they can drive by 1 week and go back to work within 10 days.
Postoperatively, after cryo, they go home the same day, usually, as I've mentioned, with some mild analgesics and an antibiotic. Within 10 days, they return back to the office to have a catheter removed. And usually at that point, they can resume all their normal activities, not only their business or any sporting or exercise can be resumed.
So after the 2 weeks, I went back to my urologist, to my doctor, and he removed everything that I was carrying. And I had no pain, absolutely no pain. I had no problem with nothing. So as far as I'm concerned, it was a total success.
Surgery is surgery. It takes a lot out of you, and the body needs some time to recover. And so it took a couple of weeks.
So I took it a little bit, you know, when I felt that the anesthesia was going away, I took the painkiller. That was the only pill I took for pain.
Oh, he was a good patient. All I had to do feed him. That's all he wanted, his food.
I said, it's very simple. It's not complicated, it's very simple, it's an in and out thing. I don't think you can beat that.
Radiation is a more aggressive approach as far as the time the patient spends in therapy. It's usually 6 to 8 weeks.
They told me the radiation would, over a period of time, the radioactivity would kill the cancer cells. There'd be some after effects, some of which they didn't know for sure.
One of the reasons why I decided not to go with the surgery to remove it or the seed implants is because my father had prostate cancer, and he had seed implants with radiation, and it didn't go very well for him. He did not have a good experience.
The immediate after effects were I couldn't go more than 5 minutes without having to make a trip to the bathroom. We'd stop probably 4 or 5 times on the way home. Urination was not only a bit difficult, but it was pretty painful. They don't remove the seeds, they're there forever. And my understanding was that you couldn't have that process again. So if it didn't work, then at that point in time it was removal. Now I ride a motorcycle all the time, and that's an important part of my life. I live my life, let's put it that way. So on the motorcycle, whenever I'd go to get off the motorcycle, just lifting my leg to swing over the seat, I would have a problem at that particular point in time. I'd lose control both ends.
So he explained radiotherapy, which I wasn't really very convinced about because it has some other side effects that I know of, that I heard of.
After the radiation, I never did get back down to a 0 PSA. It was, at that point it was 3 or somewhere between 3 and 4. Stayed that way for a period of time. I continued to have my PSA checked on a regular basis. And at one point in time, about 6 months ago, it started to elevate again, elevate very rapidly. This is like 5 years after the radiation treatment.
If the patient's a radiation failure and needs salvage therapy, I also know that patient that cryotherapy is going to serve him best, in my opinion.
So after we had a failure of the radiation treatment, my urologist suggested that I try the cryotherapy, so I had an appointment with the doctor that did that at a major hospital in Seattle. When we had the cryotherapy, there was no pain associated with it. In my first urination, I heard a little bit, but nothing like I did when I had the radiation treatment. Generally, it was pretty easy. After that, I drove home by myself. The doctor told me I couldn't ride my motorcycle for a week, which is the length of time that I had the catheter in. So the day they took the catheter in, then I'm back on my bike with no pain, no problem at all from that standpoint. First of all, cryotherapy worked for me. And obviously I'd want to share that with people that I know, friends and family, in a positive way to give them hope.
When we have discussions with patients about treatment for prostate cancer, at the end we usually will have some discussion about the financial considerations of these procedures. Cryotherapy is no exception to that.
Patients today do not have to worry about any financial worries because cryosurgery is covered by Medicare and all the major HMOs and is a well-accepted therapy today.
This procedure is Medicare approved and it is FDA cleared, and therefore their financial claims can be submitted and generally will be reimbursed by Medicare or their primary carrier.
I feel very fortunate it did not affect our lifestyle.
And I joined water volleyball and I joined sand volleyball, I joined the softball team. So I wanted to be able to continue to do those things. And cryotherapy fit right in because it had a short recovery time and it just seemed to be the answer for me.
I don't remember the surgery interrupting our lifestyle at all. Nothing changed after that. I mean, we continued all the activities we did before. There was no ongoing treatment or pain.
But I get up and I mow my lawn. I could go for a walk and I visit hospitals to visit the sick. And I just tell people about, cancer. If you have cancer, when you find out you have it, you go ahead and get it taken care of.
We still are very active and walk, and we love our neighborhood to walk in, and we still ski, which is pretty good for our age. Everybody says, "You guys still ski?" Yes, we do.
After the cryotherapy, I still do the same. I still go out, I still have a couple of drinks, I go out with friends, I enjoy myself. I like to dance. I'm a person, like I say, I'm an active person. I go out and I like to dance. And I'm a good dancer. Not because I say so, because people have told me many times I can dance, okay? Latin music, of course, call it salsa. Latin people, they love to dance.
I'm 76 years old. I can remember Pearl Harbor. I can remember the after effects of that, so that'll give you some idea of how long I've been around. I'm a president of a motorcycle club that I founded. Well, I didn't start riding a motorcycle until I was 67 years old. I'm a founder of a memorial wall for fallen bikers. I carve leather, most of which I donate to friends and family. I work with homeless shelters, and I'm still working my job.
I would highly recommend it to anyone.
I speak highly of people on the cryosurgery. It was a positive experience in a negative episode.
I would recommend cryo to everybody that I know that had cancer and can do this procedure. I would definitely recommend it.
As a urologist, you have to be comfortable and confident in what you recommend to patients. That is your probably most sacred responsibility. I can, with confidence, recommend cryotherapy as long as I am sure that I have selected the patient correctly.
According to my own personal experience, yes, I would recommend cryo to other men.
It has so many good things, that the other procedures don't have. And you might not be able to do cryo. You might not be able to do it, but you should check it out. At least that's the least you could do.
And cryo is a good option. It was for me a good option.
It really was outpatient surgery, not a lot of discomfort, and a lot of comfort afterwards that things were going well.
The cryosurgery is really a newer technology that's proven itself over the last 20 years.
If the doctor doesn't offer cryo, I would definitely check with someone that does.
If you are considering options, I would definitely put cryotherapy right up on the list with anything else.
Before cryo, my PSA reached the 7 or 8 level, and now constantly for the last 5 years is 0.1 all the time. 5 years. Twice a year is checked. So that's it. That's what my doctors told me. This is steady. There is no change here. 0.1. This is exactly where you want it to be.
It's incredible. I had my PSA test a month ago. It came out 0.01. I mean, incredible. I was 5.8 before the procedure, and now I'm pretty clean right now. So I'm very happy.
I have a new lease on life. I might live, I'm 88, but I might live with some luck 10 more years. And this will give me the chance to make positive use of those new lives, those new years. So that's why I'm so comfortable with my actual position.
My life has been great. I love every moment of it, the ups and the downs. And I think the down times make you stronger.
We just don't think about cancer anymore.
If we are dead, that's it, that's finished. So we have a duty to look after our own health, to cooperate in our own health. We have a duty to inform ourselves, to read, to research, to understand things. And once we do that, then we can help ourselves and the rest of the people.
I look forward to the future. I really look forward to the future. There's a lot more experiences to come to add to the ones I've had in the past.
The producers of this video presentation would like to thank all of the individuals who appeared in it. These people have graciously consented to speak about their experiences and some very personal issues relating to prostate cancer. Their courage is an inspiration to all who see this presentation, as well as prostate cancer survivors around the world. Please note that this information is generic and not specific to any individual. Patients should always consult with a doctor before undertaking any medical or nutritional course of action. Furthermore, these statements have not been evaluated by the Food and Drug Administration. The advice contained herein is not intended to diagnose, treat, cure, or prevent any disease. This video is not intended to be a substitute or replacement for any medical treatment. The opinions expressed in this video do not necessarily reflect those of Endocare Incorporated or Healthtronics Incorporated. Patients must seek the advice of a competent healthcare professional regarding specific health concerns. Individual results may vary. Additional information regarding cryotherapy is available at endocareprostate.com.